All right, we'll go ahead and get started. Well, good afternoon and welcome. My name is Molly McGurr. I'm the Event and Program Manager for Traverse Connect, and we would like to welcome all of you to the Northern Michigan Business and Healthcare Town Hall, presented by Traverse Connect in partnership with the Better Business Bureau serving Western Michigan. We are very excited to be able to provide you with this town hall today, including our guest speakers, which include Wendy Hirschenberger, a healthcare officer with the Grand Traverse County Health Department, Lisa Peacock, a health officer with the Health Department of Northwest Michigan and Benzie Leelanau District Health Department, Matt Willey, CEO of Monson Medical Center, Phil Catlett, President and CEO of the Better Business Bureau serving Western Michigan, and Warren Cull, President and CEO of Traverse Connect. This webinar will be recorded today and posted on the Traverse Connect website and Traverse Connect YouTube page within 24 hours. Please feel free to ask any and all questions that you might have. To ask a question, you will see a Q&A button located at the bottom of your screen. We will be reviewing all questions in the order that they are received at the end of the presentation today. There is an anonymous button to submit questions if you feel more comfortable doing it that way, but regardless, we won't be reading the name of the person asking the question. So on that note, I would now like to turn it over to our first guest speaker, Wendy Hirschenberger. Wendy, thanks for being here with us today.
Thank you. I'm going to go ahead and share my screen so we can work through a PowerPoint presentation a little bit. So again, I'm Wendy Hirschenberger. I'm the health officer for Grand Traverse County Health Department. And I'm really going to start with kind of a high level. I'm going to start with numbers. My background is epidemiology. So when the state and the governor's office was looking at the steps to reopening, there were different risk phases and assessments and statistics that were involved in that decision. So I have a little screenshot here of a dashboard that shows our region. The Traverse City region is what it's called. And some of the reasons that our region and the Upper Peninsula region got to open first was based on the fact that we had relatively low positive test rates. That's the 0.6% that you see. Our daily tests administered were also increasing, which means that our testing rates were improving. Our number of new cases daily was at a low level, and our number of deaths were at a low level. I'm going to go to a second slide just to give you a general idea. In kind of Northwest Michigan, I just pulled the numbers for the number of cases and deaths for kind of a select group of counties that make up Northwest Michigan. And you can see it ranges from 4 cases on the low end up to 100 on the high end. And I can say that the 100 cases were partly because there was an outbreak at a long-term care facility. And so that tends to, anytime you have an outbreak associated with an epidemic or a pandemic, you tend to have a cluster of cases. But overall, for our region, compared to the state numbers, we are relatively low at a total of 243 current cases and 23 deaths. So a little bit less than a 10% fatality rate, which is, still concerning for sure. We don't want to see any deaths. But we also have seen, a lot of people recover in our region. I also am sharing a graph that shows the epidemiologic curve of the outbreak as it started with number of cases. You can see the top one lists new cases. And that really just demonstrates how kind of where our sort of initial spike of cases was, and that was right around April 20th, the 4-20 point where you see the peak. And then we have kind of slowly been working our way down. We hope not to see a second spike in cases, but we're just gonna have to see how we go as the reopening happens, what's gonna happen. And then the bottom graph is the number of deaths, and you can see those just were sort of sporadic, so there's not necessarily a specific curve or wave on those. So one of the things that you've probably heard a lot with COVID-19 is the importance of quickly identifying cases and then doing case investigation and contact tracing. And this is something that we in public health do every day. We've done it long before COVID-19. We do it on all communicable diseases that are reported to us in our jurisdictions. And the reporting comes from hospitals and labs and doctors' offices. So, during COVID-19, we were able to very quickly get cases identified us, typically through the hospitals. That's typically where initially people were first tested. Now we've got some additional testing sites, and so we're notified from the labs or the testing site if there are positive cases. So what happens when you have a positive case is that, or someone who's symptomatic and a suspect case, is either they have a positive test result or we initiate getting them tested, or a physician does. And then a public health nurse does something called a case investigation. So they really talk to the person, find out when they first became symptomatic, they find out what their symptoms are, they find out who their close contacts are. And close contacts are somebody who they have frequent and prolonged contact with. So in the public health world for COVID-19, that's, within a close distance, say 10 minutes or longer. Most people have between 2 and 4 close contacts in their life. You might have several others who are other contacts, but not considered close contacts. So what we do there is then we contact those people who are considered contacts and we notify them of exposure. We do not notify them of the person they were exposed to. Some people, if they're in the same household, know who it is by that nature, but we do not release names. And so the goal with this is really to reduce the transmission. So you can see in the chart or the graph, people in red are those who are infected with COVID-19, and those in black are those that are not infected. And you can see how one person being infected can quickly spread to 6 or 8, depending on the number of contacts. So the goal is really to isolate anybody who is ill. A good way to remember that is they both start with I's. And then also if someone doesn't have symptoms, then they get quarantined for 14 days. Health departments follow up on all contacts. We're in contact with them usually on a daily basis, just checking to see how they're doing, making sure they're monitoring themselves for symptoms. So the sooner we can identify someone who might be a case, the sooner we can get them away from other people and reduce the transmission. So one of the other roles in public health is that we really try to support people who are in quarantine and isolation by ensuring they have access to the community resources they might need. So if it was somebody who is ill but maybe lived alone, we would ensure that they had, access to get food for delivery services or whatever other types of services they might need. So that's a little bit of background on just COVID-19. And as we move forward with reopening and thinking about sort of getting back to our new level of normal, I don't think we will ever return to the old normal, to be honest. We really have to look at things from a risk perspective. So looking at kind of balancing safety and risk and figuring out what that means. So as an individual, we look at face coverings. So the safest thing is that everybody's wearing a face covering. The riskiest thing is nobody's wearing a face covering. On the social distancing, that's the same thing. You can be extreme, which is kind of where we were all at with the lockdown, and that was really to stop the transmission, to try and greatly reduce the number of cases. So being at home and really having virtually no contact with a lot of humans was really the safest. And then as we progress through the reopening, we'll start to see expansion as far as numbers of people we can be around. So as far as look at the location risk. So if you're in an outdoor space with good airflow, that's really a very safe place to be. If you're in an indoor room, but it's a large room and it has a good airflow, then that's kind of medium risk. But if you're in a real small office with lots of people with poor air circulation, then that's high risk. So the kind of measures that we recommend in public health, either through local public health, state health departments, or the Centers for Disease Control, are all really things that are aimed to reduce risk and provide the highest level of safety that we can, but that are also feasible to implement. If you look at get my panelists out of the way here, sorry, so I can see the screen. So if you look at the example of, I put some pictures down here of condiments. So if you're a restaurant and you typically have on the table a large selection of condiments, those potentially are a lot of touch points for people throughout a meal, whether it's the people who are immediately sharing a meal with one another, which may or may not be their household contacts. At this point, it should be. But a less risky thing would be to provide condiment packets, so only one person has to touch those. So one thing to keep in mind in a lot of the things that have been rolled out during the pandemic are things that seem like little things, like the social distancing, face covering, washing your hands, not touching your face. They all seem like little things. But if you start to do all those little things in conjunction with one another, then you're kind of stacking the measures that you put in place to reduce your risks. So public health includes both protecting people from the coronavirus and as well as trying to get people back to work safely. They're not mutually exclusive. And we know that eventually we will have a vaccine, but until that point, we have to do what we can to be responsible, both as business owners, as employers or employees, and even as individuals. It's similar to driving. We have a shared responsibility, and there's safety in driving with multiple layers of safeguards. There's lane lines, there's guardrails, there's signs on the road, there's rules of the road that we all follow, and then there like speed limits and observing traffic lights, and there's also our specific driver behavior. So whether or not we choose to use our blinker, that we wear a seatbelt. So if we can, use all these together, it really does help to create a better way of being safe. Otherwise, it's essentially like driving with a blindfold on. And so that would not go so well. So that's why we're really promoting as much of these safety measures as we can. There are things that CDC and other experts in the world have determined that are things that are going to reduce the risk as we begin to reopen. At this point, I am going to turn it over to Lisa for a while.
Okay, thank you, Wendy. I'm Lisa Peacock. I am, as stated before, the health officer for the Health Department of Northwest Michigan, which covers Antrim, Emmett, Charlevoix, and Otsego counties, and the Benzie Leelanau District Health Department, which covers those two counties. So sort of just all around the Grand Traverse County area. And I am going to just elaborate a little bit on some of the things that Wendy said, as well as add a little bit to that. And first, I just want to say that I really applaud our local businesses. They have been reaching out to us, working very closely with us in trying to do the right thing. They have been, doing a great job with things like social distancing, employee screening, masking, using signage, and really the businesses that I have encountered over the past couple of days to couple of weeks have been doing it with a smile. And I think that just really shows how committed they are to keeping their employees safe, to keeping the public that they serve safe. And I think we need to continue moving in that direction. It just is so, so important. And I think the success that we've seen across Northern Michigan in essentially flattening the curve has been the result of all of us working together, doing those small things that Wendy mentioned to do the right thing. And I think we need to continue to be vigilant in all of those things and also in finding this new normal. COVID-19 is not going to go away anytime soon. We know that it will be part of our world. And until we have a vaccine or a cure, all of these measures that we've been taking to protect ourselves and our communities are going to be important. And I think employers and businesses need to know how essential it is that employees and the people that businesses are serving be protected. One sick employee can really affect a community, not to mention the impact that it can have on a single business. You can't hide from COVID-19. And so I think one thing that everyone needs to remember is as the rules become less black and white, as less is prescribed in executive orders and public health orders, the more our level of personal responsibility rises. And I think we just really have to all remember that we all play a role in this really important protection for the community. And so making sure that we do things and consider things very carefully as we look at what is safest and riskiest. If we are experiencing any symptoms of illness, we should definitely not be going to work. If we're experiencing any symptoms of illness, that might not be the day that we want to gather with our family. Even though some things are allowed, we still have to, insert that level of personal judgment into those decisions. And so the executive orders have established some rules. There are lots of black and white guidelines, but not everything falls into those black and white scenarios. And so as Wendy described in that earlier slide, determining what is feasible and what places us in the best and safest position. There are some minimum reopening requirements, which are indicated on the slide. And I think that everyone working on their COVID-19 preparedness and response plan by June 1st is something that everyone is working on very heartily right now. Our local health departments have worked really hard to provide resources that kind of compiles all of that information in one place. You can look at either of our any of our health department websites to find some of those resources, but they involve things like providing training and protocols and considering all levels of controls in keeping our workplaces safe. So it could be physical controls such as putting up, plexiglass guards or making sure that we rearrange our workspaces so that we can accomplish social distancing, making sure that our employees have access to PPE such as masks and hand sanitizer and protective materials like that, looking at all of our cleaning protocols. But even more importantly than that, thinking about the ways that we conduct business and really thinking innovatively in that way. I think restaurants and stores, we've seen doing that over the weekend. And one thing that was really an observation for me as I was moving around this weekend is that every time somebody does the right thing, it encourages other people to do the right thing. And so each time one of us wears a mask into an establishment, other people see that and they feel more comfortable wearing that mask themselves. We also know from our experience with providing other public health interventions that when there is a strong message that something is a rule, not an option, more people are likely to comply. And so I think we need to really support our businesses in doing those right things and make sure that we're all following those examples ourselves. So as we work forward, we need to be looking at things like, how do we conduct meetings? We've learned a lot about technology, and I know, as an employer, I have 2 different health departments, 8 dental clinics. I employ a lot of employees as well. I share the same challenges that all of you are sharing in trying to keep them safe and trying to conduct a business that can remain solvent and keep moving forward and doing the work that we do. And so looking at things like, can we continue to do things in a remote way that we've learned how to do so efficiently now? I think when we're planning our reopening, we're looking at things like those physical controls, but we're also looking at administrative controls. Do our policies reflect the support of employees who need to stay home when we're sick? Do we make it possible for people to continue to work remotely when that is working well and contributes to a productive work environment? Does that make space within our office spaces for other people to work that need to be there in person? So all of those levels. So as you are developing your plan for your reopening, there are certain things that you need to consider, and these are just some examples that we've included in the PowerPoint. You know, looking at areas where we might be sharing items and minimizing that. Looking at our floor plans to maximize that 6-foot distance. And like I said, that may involve having some people work remotely. I know at our health department, we're continuing to have our back office staff work remotely so that we can make space for those who need to be there serving clients. Avoiding common gathering areas, avoiding in-person meetings when we can, limiting travel at this point, following those executive order rules, even when it comes to business. When employees do have to travel, especially to an area, this is a question that I get all the time. You know, if I've traveled to another area, do I need to quarantine when I come back, or do I need to have my employee quarantine when they come back? And again, as the rules become less black and white, this is where that judgment needs to be applied, and to think about all of the elements that might make that a safer situation. You know, did they go to help their elderly parent in a household that has also been isolating? Is it in an area that has a similar incidence of COVID-19? Or is it an area where cases are rising? Did they visit a household where maybe someone is leaving as a healthcare worker in a hospital every day? So we have to take all of those things into consideration when we're determining what is the safest decision. Making sure that we can plan for visitors as well. So there are all different kinds of businesses. And again, I'll just point out what a great job many of our restaurant, food facilities, stores have done over the past weekend. We saw many of them moving forward with opening with strong, solid plans in place, often in consultation with the health department. And we also saw some who waited because they didn't feel prepared or ready yet. And that is all okay. And so I think it's a case-by-case situation that needs to be considered very carefully. Across the Northern Michigan Public Health Alliance, we have been implementing employee screening with employers that have been open throughout the COVID-19 crisis. And we know that that's a really important measure. An employee who comes to work sick is not only putting themselves and their close coworkers at risk, but they're truly putting the community at risk as well as that business. And so it's just really, really important that that we recognize that in normal times, we have a very strong work ethic in Michigan. Most people work through a cold. Most of us go to work when we're mildly ill all the time, and that's normal for us. And we wouldn't imagine doing anything different. But in this new normal, that needs to be considered differently. And that is someone who should not be at work in person. So I think it's really important for businesses not only to be screening their employees, which is required by the executive orders in most cases, but to be able to know who they have contact with. So if the health department calls and says one of your employees was positive for COVID, do we know who they had contact with? How do we communicate with our groups of employees? How do we identify who else they may have been in contact with, other visitors to the facility? In some cases, we aren't able to fully identify all of those close contacts, and that's when you may see us make a public announcement. So being aware that that may have to happen. But the best thing is being able to avoid it in the first place by encouraging our employees to understand that they should not be coming to work sick. And again, the guidance that is listed here on the slide includes many of the things that we've talked about, providing signage, providing PPE, making sure that your employees know that you care, that your business knows that you care, and that the customers that you serve know that you care. So with that, I will stop and just indicate that we have toolkits and resources available on all of the websites that are listed here. And Wendy wanted to make sure that we announced that there is testing available in Traverse City this weekend at the Pit Spitters Field parking lot. On Saturday and Sunday, they are partnering with the National Guard to bring some widespread community testing. And we want everyone to know that the testing priorities have been opened over the past week. And pretty much anyone who wants to be tested in our Northern Michigan area can be tested. And you can call any of the health departments. You can visit the Pitt Spitters Field this weekend, but we'd be happy to direct you if you need testing.
Perfect. Well, Wendy and Lisa, thank you so much. I'd now like to turn it over to Matt. So Matt, go ahead.
Great. Well, thank you, Molly. My name is Matt Willey. I'm the president of Monson Medical Center. Very much appreciate Traverse Connect putting this together this afternoon and appreciate the chance for Monson Healthcare to be a part of it. So I'm going to share my screen and kind of walk through some of the activities that's been going on here at Monson Medical Center. So what I'm hoping to cover today is, as we think about kind of the healthcare response, kind of talking about some of the challenges that were posed by some of the supply chain disruption, and Wendy and Lisa spoke to some of it regarding the PPE, which is the personal protective equipment. I'm going to talk about where we are at with that. What are the adaptations? What are the changes that we've had to do over the last couple of months in order to best prepare and to keep the community safe? And then where are we at right now? As we think about the months ahead and the weeks as we kind of go into our new normal, what are some of those activities that are ongoing? And so just a very high level summary, you know, healthcare systems are always planning for emergency management situations. And so at the beginning of this year, as we started learning more about COVID-19, we started activating our pandemic response plan. That is something that we've had, and it is something that we look at on a routine basis in order to respond to whatever comes our way. And right when the month of March started is when we really officially started what we call incident command. That allows us to kind of deploy response plans very quickly. It allows us to get the right people in the room at the right time in order to effectively make decisions and to execute them in very short order. So incident command allows us to get the resources available and deploy them in a very quick manner. And you can see it was the middle of March is when we had our first confirmed case at Monson Healthcare, and that was actually here at the medical center. It was just a few short days later where within Northern Michigan and Monson Healthcare, we had our first COVID-related patient who passed away, and that was down at Cadillac Hospital. So that's kind of how we started getting ready for everything. And one of the things that's probably been top of mind and something that's out there in the community, we hear a lot about the personal protective equipment. Do we have the necessary supplies and protective gear in order to keep our patients safe, our staff safe, and visitors as they come into the facility? And, you know, throughout all of this, our normal supply chain channels have been disrupted. And with the outbreak starting in China, that is where we receive a lot of our equipment. And so we've had to get creative to ensure that we have adequate supplies. We hear a lot about N95 masks, surgical masks. We've been able to work with different vendors, with new partners, in order to secure additional supplies for all of Monson Healthcare. And so those were kind of the immediate needs. We've been able to address those. But as we think about kind of the supply chain world, some of the issues that we may have, we may not know about today. So again, I had mentioned N95s, we've been able to solve that at the present moment. What we are thinking through, or what are some of those unanticipated shortages that may come about as a result of just the overall disruption to supply chain. You know, the national stockpiles went to the specific hot zones throughout the country, so we did not receive a lot from those distributions. And as we've been acquiring new PPE, because we're having to use these different channels, it's actually about 10 to 20 times the normal amount that we've been having to pay. So over the last couple of months, there's been millions of dollars that Monson Healthcare has spent on ensuring and procuring the necessary PPE. And so now that we've received some of it, we want to make sure that we are good stewards of those resources and how can we best preserve it. So I'm going to talk a little bit how we've been centralizing some of our resources, how we are trying to ensure that our current supply is sufficient. We have a supply chain PPE calculator, And what that does is every day we look at what's the current utilization of our supplies, what's our current inventory, and then we track out how many days on hand that we have available. And as we kind of get into a red zone, we kind of monitor that and we're able to address accordingly. And then last thing I'm going to speak to for preservation has to do with how we're monitoring access to our facilities. And so the first thing I want to highlight is that when this all started, we did decide to create regional hubs of where we would care for positive COVID-19 patients. One of those locations was here in Traverse City at the medical center. The other in our east region was at Grayling, and then also in our south region at Cadillac Hospital. And even within those three facilities, we have designated units specific for COVID positive patients, as well as patients that we are waiting for results for. So we're able to isolate them. We're able to ensure that our staff has the necessary PPE, that they've all been trained appropriately with donning and doffing of the equipment, so that they can ensure safety for the patients and for themselves. And what we've done from a kind of an access standpoint to our facilities, it was mentioned earlier about mobile collection sites. So we're making sure that we kind of try to have a wide variety of where people can go instead of just congregating at the hospital. We've put in restrictions for our visitors for the safety of community members to make sure that we don't have undue exposure to different people. We're all familiar with how we had to cancel some of our elective procedures, non-urgent cases. We are in the process of bringing those back and caring for those individuals. I'll speak to that. And then we also modified our operations to all of our service, but also with lab, excuse me, radiology as well. And then we've also only allowed critical staff to come into our facility. We've been screening them 24/7. We have all of our entrances. Some have been shut down, but the ones that are open, we have constant screeners available for all those symptoms, making sure that we have healthy individuals and patients and visitors coming into our campuses. So here are just some stats related to Monson Medical Center. You can see we've had 33 inpatient individuals that have been positive for COVID at the medical center. We've been able to discharge 21 of them. We currently, as of this morning, we have 2 positive patients here at the medical center, and we have had 10 individuals that have passed away within our care during the last couple of months. You know, with us restricting access and making sure that we're here for emergent services, our volume has dropped, not just here at the medical center, but across all of Monson Healthcare, about 50 to 60%. And that was probably felt the most during the month of April, kind of in that first couple of weeks. And over the last few weeks, we've been starting to phase in the reopening. And I'll speak to what that means and kind of where we are at with that. But it's been pretty significant in terms of how we really tightened up the facility to make sure that we were going to be in a position that if we did see a surge, a big peak of patients, that we would be able to care for them. We wanted to make sure we had enough ventilators available. We had a plan in place where we could convert 5 or 6 entire nursing units to care for COVID patients if the need arose. So we were definitely making sure that we were going to be in a good place for whatever came our way. And, you know, this is probably the most important message that I want to speak to for the forum today. We need to get out to the community, and it's something that we are trying to relay, that if people have healthcare needs and if there are emergencies that are going on, that they need to come to the hospital and that we are here to care for them in a safe environment. We do not want people delaying care. We are hearing some stories of that, and that can create poor outcomes. When people do come to our facility, we do have a safe environment. I had mentioned the screening. So we have asymptomatic people currently in our facilities. I'd mentioned the visitor restrictions. And if there is the need for a COVID patient to be here, that individual is within an isolation unit. So again, we want to get the message out to the entire community that it is safe and necessary to come in to receive care if you feel it's appropriate. If people are having chest pains, we don't want them staying at home we want them coming into our emergency department. You know, as we think about going back to our new normal, we have been having an internal reopening task force, and that group gets together twice a week. I'm a member of it. We have representatives from all of Monson Healthcare. We have clinicians, we have nurses, we have providers, we have operational leaders, but that's the group that kind of helps determine what is the best way for our phased approach to reintroduce services to the community. And one of the things that we always look at is making sure that we have the PPE availability. I'd mentioned that kind of supply chain calculator, days on hand of services, making sure that we have the appropriate testing capacity so that as we're getting ready to do surgical cases, we can make sure that those individuals are safe, and making sure that it's done consistently across Monson Healthcare. We want to make sure that there's not a way that it's being done in Traverse City, which is different than how it would be done in Grayling or Otsego. We want to make sure that it's a unified approach to doing so. And ways that we do that is we might introduce 50% of our outpatient clinic visits coming back for a few week period. Based upon that and ensuring social distancing with that, we would then come back and go to 75%. Do that for a few weeks and then get back, you know, to normal capacity, always making sure that we have telemedicine capability. So we are proceeding incrementally. We're making sure that our decisions are made using data and what's coming out from a science-related perspective, and always making sure that we have masking. So any individual who is within any of our clinical care facilities, whether it's a staff member or a visitor or a patient, we're making sure that they are masked 100% of the time. We are putting in the proper social distancing safeguards, such as waiting rooms, removing chairs from waiting rooms, and very much promoting the use of hand hygiene throughout all this time. You know, probably what I just want to finish up with, and it's really just a word of gratitude to the entire community. It has been so impressive to see everybody show their support to the Monson Healthcare family. We continue to get words of encouragement. We get letters and cards every single day. We're getting food donations. And so it's been a very, you know, unique time to the staff here at the medical center and at all the other facilities. And that level of support has really been reassuring to everybody, and it lifts everybody's spirit. So I know a lot of people listening today help make that possible. So we very much appreciate all that the community has done for us. Molly, that's kind of the end of the formal presentation, but look forward to questions shortly.
Thank you so much, Matt. Really, really appreciate it. And again, you know, I'm sure everyone here just wants to thank everyone in the medical field. Thank you so much for everything that you guys do. So next, I would like to turn it over to Warren Call.
Thanks, Molly. And Matt, again, to reiterate what Molly said, and I'll say this to Lisa and to Wendy as well, I can't say enough about the responsiveness, the excellence, and the professionalism that we've seen out of our healthcare professionals, our public health officials. It's just been phenomenal. And it really goes to show that we really have some key expertise here that's been amazing throughout this whole pandemic and the response process. I wanted to touch very briefly on what Traverse Connect is doing to support our community and these important healthcare partners with the COVID response and recovery efforts. I'll be brief in my comments because I do want to make sure that there's plenty of time for your important questions toward the end. So very briefly though, resources. That's one of the key things that we've been providing to the community and to the businesses and partners throughout the community through this process. We formed initial information and coordination as the crisis really hit home. And that involved, you know, getting out that initial information about the loan programs, the grant programs, the changes to unemployment insurance, the changes to some of the federal and state policy guidelines. That was a key need from the business community early on, and we were able to provide that. There are resources that continue to be available on our website for that. Obviously, that also involved quite a bit of legislative and policy analysis. There was a lot of things changing. There's been over 100 executive orders from the governor's office, as well as a number of things at the federal level. So the procedures, that impacted, the guidelines that businesses and other employers in the nonprofit sector needed to deal with. That information has been provided on our website and through other materials. And then again, can't say enough about our partners working with state agencies and the local health department on resources for reopening, so that our companies and our businesses have the personal protective equipment, the toolkits, and the guidelines for doing that. So as our public officials produce that material, we're getting it out to the respective industry contacts so that they have the guidelines they need to open up in the right way. We did also help initially with some of the immediate supply chain and logistics issues, helping Monson connect with some of the manufacturing folks to address some of their acute needs that Matt touched on. But really, one of the most impactful things, and I hope that many of you have taken use of this, the webinars on topics ranging from the PPP loan program to heightened cybersecurity concerns that come with the federal programs. That's been an area of, I think, concern for the community, and hopefully we've been able to provide some information to answer some of those questions. We've also provided a number of industry-specific forums. As we look at this reopening, we will continue to do industry-specific things, bringing state-level policymakers to these forums to get your questions both out there and hopefully answered in a timely manner, so that you have the information you need from public officials and industry experts to address the reopening. Those webinars and forums have seen thousands of viewers and attendees, and we will continue to do that. I also want to reiterate something that our Wendy and Lisa touched on. You know, we are an example for the state, and I believe reopening in a safe and responsible way, we can serve as a proper model. The opportunity to open is obviously a responsibility to do it right. And so with that, again, one of the silver linings to this situation has been the broad kind of cross-sector collaboration that we've seen. I want to commend the community and specifically Grand Traverse County administration for setting up early on a joint operations center. That's a broad-based group of organizations from the public sector, from health and safety, law enforcement, education, the business community, the nonprofit community. And initially that was a 7-day-a-week meeting. It is now thankfully been reduced down to 3 days a week as we're moving through the acute phase of the crisis. But that has served for a very good cross-sector of community collaboration, especially communication, so that the community hopefully has seen unified messaging on what's going on, and it's unified messaging from the health department, from Monson, from county administration, from business and industry leaders, so that you get comprehensive information. The partners that have been involved in the Joint Operations Center have also worked to create positive and welcoming messaging and marketing as we open up and work through this reopening process. You may notice the Stay Safe to Stay Open print material and social media information. That is, again, a public-private partnership geared toward making sure that the community knows that we are opening in a safe way to get our businesses back on track. The emergency support function. We've established an industry council, including over 24 organizations representing that cross-sector of different industries, so that we can both disseminate the emergency management information that comes out of the Emergency Operations Center that we're involved with, but also, just importantly, it's got to be a two-way street. Getting the private sectors, your challenges, your concerns, your questions back to the Emergency Operations Center. That's been an important function. I'd also touch on the business advocacy. So Traverse Connect and our partners in the Northern Michigan Chamber Alliance have been advocating for this phased regional reopening. And our businesses take this seriously, and they're ready to do this right. So we're making sure that that is known by policymakers in Lansing. We are making sure that they know that you are ready to educate your customers and employees so that we open up the right way for everyone's safety and health. The final thing I'd touch on is that we're trying to do this from a standpoint of community-wide support. All the services and information that we are producing and doing in partnership with other entities are free and available to all companies, all public agencies, all elected officials, all of our partner organizations, chamber organizations, and economic development organizations across Northern Michigan. Because I think it's important that we all work together and think proactively about how our community can address the long-term economic and community impacts. And really, despite the uncertainty that currently exists, having this cross-sector collaboration and teamwork is going to be what helps us have community resiliency and economic recovery. So with that, I will pause there. I am happy to take questions at the end, but I want to provide some time for Phil to address the West Michigan viewpoint as well.
Thank you, Warren. Better Business Bureau covers 38 counties on the west side of the Lower Peninsula. And as such, it's always a challenge to adequately address the needs of every region on the west side of the state. And so when we have a partnership opportunity such as we're allowed to participate in today, we are so grateful for that. And when Warren talked about returning to work the right way, I thought that was a wonderful transition to what we're going to talk about. It is so important to truly care about the well-being of your team, of your partners. They need to know that you mean what you say and you act accordingly. So they need to know that they can count on you as a leader. They need to know that you can deliver what you promise. Customers and team members must believe you are competent and capable, but most of all, that you really care about their well-being and the well-being of your customers. You know what you can do, or you don't know what you can do, and you freely admit it, because it builds trust by being modest, I would say, being humble. And I'm going to now talk about research that the BBB has done to show what builds trust. So as you think about your organization, internally and externally, to the degree that your team and your customers perceive you as being strong in these 5 categories: honesty, transparency, proactivity, being humble, and defining that in a way that means that you don't know everything and you're open to their outside and input, and being equitable so that you share it. Warren was talking a lot about all the collaboration and cooperation throughout the region. That's an equitable issue where you're all sharing what you have. It lifts all boats. And at BBB, we continually focus on businesses and organizational leaders building trust. And in a time of economic uncertainty, it is crucial that businesses build trust, because as consumers or business to business customers, we're going to go where we can believe. Claiming to be honest or transparent, proactive or humble or equitable without practicing the behavior associated with those gestures will actually lead to more distrust than increased trust. So if you're going to claim that you are trustworthy, you better walk the walk. And honesty, how do we define that? Well, this gesture is described as the tip of the iceberg for gaining trust. Often, even if a customer or a team member is referring to one of the other gestures, they may be describing the business as being honest or dishonest. That's one of those things I had to learn as a leader over the years. This is the most visible gesture, and the one organizational leaders may think of most often as the best way to build trust with customers. Throughout this pandemic, we've seen cases of businesses being dishonest, either with price gouging, claims about their services or products effectiveness combating COVID-19, or even shipping times. I know that I bumped into that. I'm guessing all of you have too if you ordered anything online. Think about our frontline workers and the stress and difficulties of their lives. Do customers want to come back to a business they believe has been dishonest in any way, either with the customer or with their employees? Do team members want to be associated anyway with an organization that is dishonest? Do we want to lead an organization that values profit, tradition, or other benchmarks of leadership and success so much that your workers feel unsafe or are actually made unsafe? Transparency is one of the tools that you use. It has a huge role in building trust within this pandemic. As has been mentioned, every business needs to have a plan and needs to share it. Be transparent with your employees about new policies and how your business is doing. Be transparent with your customers about policies and what you're doing to keep them, employees, and the overall community safe. Communicate, communicate, communicate. We need to go way beyond compliance that just meets legal obligations or brand imaging to have a good image. Your transparency and vulnerability allow your team members and customers to build stronger relationships and more honest feedback to exist. I went right by the transparency. I'll see if I can go back. Yes, I can. So proactivity. This is when we did an internal trust assessment recently, a couple of our employees didn't think we were being proactive enough. And we had to dig into that, what they were looking for in proactivity. So while this slide is written to apply specifically to customers, it also applies to your team. As leaders, we are continually thinking and investigating opportunities to better serve them both. Each employee is a customer of your leadership and your employee culture. Do they buy into it or don't they? So in this context, do we anticipate employee needs? Are we proactive in that way and provide solutions before they even have to ask, and at times even without the employee knowing we've done it? Do we respond quickly and affirmatively with good communication to employee requests or issues? Be proactive. Guidance and best practices continue to change every single hour and day during this pandemic. Nobody has done this before. Stay up to date on recommendations from the health department and other experts and act as needed. Also, watch what other businesses are doing and what customers' employees are responding to. We are likely to find the first plan can be changed a bit to be more effective for customers and staff. Be flexible and willing to adjust. And then humble. I'm going to tell you a story. John, a retired educator, underscores how a local hardware store has kept him as a longtime customer when he has so many other choices that might save him money, like larger box stores, for example. John explained that the store is very difficult to navigate unless you've been there many times because it is small and crammed with merchandise. Might sound familiar to you. He told of going there for a tool he needed, but the store didn't have it. The service person helping him immediately referred him to a competitor that he knew did have the tool, even though he told John he could order it for him. The service person felt that John needed the tool that day to complete the weekend project he was trying to do. The service person spent further time with John explaining to him how to ensure the tool was the right one, how to save some time and money on his project. John was appreciative and knew he would return to this store again and again, regardless of the fact that he visited a competitor who could meet his need in the moment. The hardware store has won John as a longtime loyal customer because it was humble. It saw the customer as a partner whose interests it was bent on protecting and put the customer's immediate need over the company's short-term profit. Think of your team inside your organization the same way. Am I willing as a leader to let them know that I don't necessarily have a better answer or response than they do? Am I willing to allow my team members who are working hard and trying their best the freedom to try it their way? Is it okay to admit to your customers and staff that you are working through a process that isn't really clear? A little vulnerability will help customers trust that you have their best interests at heart and are working for them. And equitable. We have an accredited business whose internal motto is, we do the right thing even when no one's looking. Think of that company that you work with as a customer that went above and beyond for you. Whatever it was, it probably cost them a little something, time, product, labor, but that small act, and usually these are small acts, they have a big impact on you. Consider an instance where you're looking for an important product or service and the online business product or service offered by a home improvement company looks like it meets your goals for quality, timeliness, and cost. Then something happens to change the availability, timing, and cost of the product or service. I'm guessing that Monson's going through that on a daily basis right now. If the business fails to inform you they cannot deliver what they promised in a timely manner, that would likely make it difficult for you to work with another company. You've gotten behind. The company you're attempting to buy from is being inequitable because more than not being truthful, the company or salesperson is retaining the power they have over the customer. It's essential in building trust that a business shares knowledge and power in negotiating with the customer. Think of this now in the context of team culture and employee relationships. How willing are we to share our concerns about the financial implications of a proposed program? How willing are we to go with the team member's idea when we think we have a better one? how willing are we to share information that we with our team might think we can build power with a collaborating organization as Traverse connected with BBB today? Or the potential return to work dangers may exist. Let's be honest about them. So to finish up, I'm just going to tell you that BBB has a great internal trust assessment that if you're interested, we'd be glad to share information about with you. It's very inexpensive. We'll share the info with you for free. The key issue there, and we did it just with our staff recently because we want to know how everybody was doing working from home when before we'd always studied it working in the office. This is available to you. Let me know at BBB. We also have a COVID-19 app that has sort of aggregated a lot of content about sourcing materials and other valuable information. And with that, I'll finish up. Thanks so much for your time.
Perfect. Phil, thank you so much. Really, really appreciate it. We have just a few minutes left here, so I am going to go over some of the questions we have coming in. If we're probably won't be able to get to all of them, so please feel free to email us and we will follow up directly with you. But we did have some questions in regards to screening. That seems to be a pretty popular one we're getting, and testing. Is the testing at the baseball field only to tell me if I am sick right now? And can't I just get it on the way home? When will the antibody testing be available to let me know if I had it in the past?
This is Wendy. I'll tackle that one. So the testing that is going to be at the baseball field and the testing that is at Northern Michigan Health Services Incorporated and the Monson Foster Family Care Center, I had to remember the right name, sorry. Those are all diagnostic testing. So for the purpose of controlling a pandemic, that is the kind of testing that is most beneficial to us right now. It allows us to identify who is sick and then quickly isolate or quarantine so we slow the spread of the transmission. A lot of people have been asking about the antibody test. So the problem right now is, yes, while the antibody test will tell you if you were exposed at some point, whether or not you develop symptoms is going to be dependent kind of on you as an individual. But a lot of those tests are unreliable and they're generating, they have low specificity and low sensitivity, meaning they're either generating numbers of higher false positive or higher false negative. So at this point in time, from a medical perspective, we are not recommending the antibody testing. And I think a lot of individuals feel like it might be useful to them, and at some point it will down the road, but at this point the tests are just too unreliable.
Perfect. Thank you, Wendy. With cases being reported by the county the person lives in, how do we stay appraised of cases of those who visited our area now that we've partially reopened?
I think I can tackle this one too. Lisa, chime in. Because we recently had this happen and we will continue to have it happen. During any sort of outbreak, epidemiologically, you do track cases based on county of residence or state of residence. Since this involves all 50 states in the United States, that's how it is tracked standardly across all of the United States. We will be tracking exposures, and you will likely see our contacts trace number on our dashboard and other health department dashboards. Those numbers will go up, and so we are still doing what we can to protect our communities by investigating any exposures that may have happened here. We just may not get to count the cases.
Perfect, thank you. And how many COVID patients do you currently have as inpatients?
Yeah, so currently at the medical center, we have 2. And that was an increase from yesterday from 1, but we've really been kind of seeing that flattening of the curve. It was the middle of April when we kind of had our peak in terms of cases. And since that time, it's been kind of a steady state of kind of fluctuating between 0, 1, and 2. But that's where we're currently at here in Traverse City.
Thank you, Matt. What happens if I get tested and it comes up positive?
I'm going to let Lisa chime in unless
Let
you
me
want
take that one. So when we are notified of a positive test, as Wendy indicated earlier, we are notified by hospitals, labs, providers. That is a requirement by law for any communicable disease. We immediately contact that person who's had a positive result and start a case investigation and go through the process that Wendy described in a couple of our initial slides, identifying where that person has been, who they've had significant close contact with, and then we contact those people and conduct the same kind of interview with them and keep going down the line until we've reached everyone who was potentially exposed. The people who are sick are then isolated, and the people who are not yet developed symptoms or haven't developed symptoms are quarantined, meaning they are isolated from other people and self-monitoring for symptoms. We also maintain contact with them on a regular basis, often daily, to ensure that they're doing okay and that they recognize any symptoms that might be developing.
Thank you, Lisa. I do realize it's 1 o'clock. I do want to be respectful of our presenters' time. We do have 2 more questions. Are presenters able to take just 2 more, or if you have to go, that's fine too. I know you guys are extremely busy. Okay, so looks like they're not in their head, yes. So we'll ask these last 2 questions here. So the first one is about brochures. Once we're able to reopen, will brochures be considered a liability due to their potential of spreading the virus?
I can answer that one. You know, any surface, anytime we can do something electronically or avoid touching a shared surface is going to be the safest bet. So again, that has to be considered on that spectrum of safe to risky. And if there's another way to convey information besides using brochures, we are encouraging that as the safest option. At times, it is very important to convey information through paper in some circumstances, legal documents and things like that. And so we're going to encourage, you know, hand hygiene, using hand sanitizer, making sure that we're not sharing pens and things like that. So.
Perfect. Are the test results from sites such as Rite Aid being given to the health departments for documentation and possible contact tracing?
Well, we don't have any of those sites here in Northern Michigan yet, but my understanding from the state health department epidemiologists is that yes, that information, that's one of the requirements for the testing is they do have to at least provide positive results so that local health departments can do the case investigation and contact tracing.
And it looks like our last question here is, are daily self-screening logs required for all businesses or just restaurants?
All businesses are covered under the current executive order, either in the general section or by sector. Some of the sectors have different requirements in terms of in-person screening or self-screening, but employee screening is a key protective measure in the pandemic mitigation strategies and is included in the executive order for all businesses that are open.
Thank you, Lisa. I know there was a few questions we weren't able to get to, so again, I just want to reiterate, please feel free to email myself. It's molly.mcgurr@traversconnect.com, and I will be sure to get any and all questions that you have over to our experts here today. And on that note, I would just like to thank our experts for your time and your expertise. Matt, Wendy, Lisa, Phil, and Warren, thank you all so, so much. We really appreciate it.
Thank you.
For having us.
Of course. I hope everyone has a great day. Stay safe, stay healthy, and we hope to see you at our next webinar. Thanks, everyone.
Thank you.